Is, for example, I worked the last 2 days, and so 2 days ago I left during the evening shift, went home, came back in the morning. Some of the patients I'd admitted to the hospital, they were still in the ER, and that's because there's just no room for inpatient beds. Everything's still backed up, and so even those patients that came last week, they were obviously maybe didn't have oxygen. Even though when you put them back on oxygen, they may have heart issues, kidney issues, those become decompensated. And so to fix them and get them back to a point where they're stable for discharge, that can take days. And so those patients are still, in